Hello. Today I'm going to talk about the consequences of not addressing ADHD. If you remember, I've shared my view on ADHD as a spectrum. What I discussed today might not apply to everyone with ADHD. As I've mentioned before, it all depends on various factors, including the severity of the condition and environmental factors like family situations. So, starting from children and younger adults, schools are actually one of the best places to notice kids who might have ADHD or ADD because teachers see how they learn and interact every day. But here's the problem. Most schools aren't fully trained or prepared to recognize the signs. When ADHD goes unnoticed, it can lead to a lot of frustration, shame, and feeling like they are not good enough. This impacts academic performance, lowers self-esteem, and makes socializing much harder. These kids might struggle to connect with their peers, and sadly, they are often more likely to be excluded or even bullied by other kids. And it doesn't just stop at school, it affects home life too. It's a ripple effect that can really take a toll on child's overall well-being. As kids with ADHD get older, the challenges can grow. We often see higher rates of anxiety, depression, oppositional defiant disorder, behavioral issues, and trouble navigating social situations. But here's the good news. Early treatment, right treatment, can make a huge difference. For instance, earlier treatment can reduce the risk of developing anxiety disorders by 85%. The chances of smoking cigarettes or developing substance use disorders later in life drop by 70%. So it's not just about improving focus or behavior. It's also about giving these kids a better chance to have a healthier, happier future. Teens with ADHD are more likely to engage in risky sexual behaviors. The rate of teen pregnancies is 38% in this group, compared to just 4% in the general population. There's also a higher risk of sexually transmitted diseases, 17% for those with ADHD versus 4% for those without. By the age of 12, kids with ADHD are 1.3 times more likely to get injured compared to their peers. Treatment for ADHD can reduce the risk of injury by 43%. That's a pretty significant drop. When it comes to adults, ADHD doesn't just affect kids. It can impact adults too. At workplace, people with ADHD, if they find the job, the career that they like, they can thrive, and sometimes they can be the best. But what we see more often is worse job performance. They have a harder time getting along with supervisors or coworkers and are more likely to get fired, laid off, or they may get bored so quickly and quit. Overall, their income is less than people with no ADHD. There is a strong link between adult ADHD and unemployment. One study found that adults with ADHD are 42% less likely to be employed full-time compared to those without. And the economic impact is huge. The loss in workforce productivity due to ADHD has been estimated to cost the US between $67 to $116 billion every year. You can find all the references for the statistics that I'm sharing with you down below on the description. When it comes to family life, ADHD can have a major impact on personal relationships. Studies show that people with ADHD are significantly more likely to have been divorced. They are more likely to have anger management issues and become verbally abusive when they are angry. They may struggle more with parenting, experience higher levels of stress, and have more difficulty managing family life. This can lead to poor relationships with their children. In my practice, I see many adults with ADHD who grew up in a dysfunctional family situation and report childhood traumas, emotional, physical, even sexual abuse, as most likely at least one of their parents had ADHD. Remember, 78% heritability of ADHD. When you think about it, when it's not treated, these traumas can often get passed down from generation to generation. After about 12 years of follow-up, research shows that 38% of individuals with ADHD had at least one diagnosis of cardiovascular disease, like heart attack or stroke, compared to 24% of those without ADHD. One of the key factors contributing to this is poor health self-care, which has been shown to reduce life expectancy by 13 years compared to people without ADHD. ADHD is more common among individuals with a body mass index BMI of 40 or higher. About 42.6% of people in this group are also diagnosed with ADHD. On a more positive note, studies show that with treatment, there is a significant decrease in all-cause mortality, especially for deaths due to unnatural causes. There are risks of car accidents. People with ADHD are about 2 to 4 times higher risk of motor vehicle accidents than those without ADHD. Studies show that with treatment, the risk of accidents drops significantly. They are 38 to 42% less likely to have accidents during the months they are taking their medications compared to when they are unmedicated. Criminality. Research shows that individuals with ADHD are 2 to 3 times more likely to display aggression and 2 to 4 times more likely to be incarcerated compared to the general population. However, medication can make a significant difference. Men with ADHD are 32% and women are 41% less likely to be convicted of a crime when they are on medication versus when they are not. There are comorbidities with mental disorders that I will be talking about those one by one in my future videos. Adults with ADHD are at a much higher risk for mental health conditions. They are 3 times more likely to develop major depressive disorder, 6 times more likely to develop dysthymia, and over 4 times more likely to have any kind of mood disorder. ADHD is also linked to a 4 times higher risk of dying at a younger age, and this risk increases as the number of psychiatric comorbidities rises. If they have a comorbid bipolar disorder, when they are not treated earlier, they could have an earlier age of onset for bipolar symptoms, the worse overall course of illness with shorter periods of wellness, and more frequent episodes of mania and depression. On a more positive note, treatment has shown to lower the risk of suicide mortality by 30%. Substance use is a big one. Those with ADHD are twice as likely to develop substance abuse or dependence compared to those without ADHD. The rate of comorbidity is up to 71%. People with both conditions tend to start using substances at a younger age. They end up in the hospitals more often and have a higher risk of suicide attempts. They are also more likely to abuse multiple substances, struggle to stay clean, and have a harder time sticking with their treatment. As they get clean, they face other life situations, conflicts, losing their jobs, and different problems. So they go back to using substances again. But here's the good news. Stimulant treatment lowers the risk of developing a substance use disorder or smoking by more than 70%. The reference is down below. Did you know that adults with ADHD have a higher risk of developing dementia? A large national study followed over 109,000 people for 17 years and found that adults with ADHD were 2.77 times more likely to develop dementia, even after factoring in other risks like obesity and diabetes. Research suggests that having a history of ADHD could increase the risk of developing certain neurodegenerative diseases like Lewy body disease by as much as 5 times. Studies also show that prescription stimulant medications do not increase the risk of dementia. In closing, I want to remind you of my belief again. ADHD is a spectrum, meaning it impacts people in many different ways and to varying degrees. The more severe the ADHD, the bigger the risks and challenges can be. On top of that, a tough or chaotic childhood can make things even harder, leading to worse outcomes later in life. This is why it's so important to understand ADHD and provide the right support earlier on. Early diagnosis and treatment of ADHD may help alleviate the risk of these harmful outcomes. It can change the entire trajectory of a person's life. Thank you for watching.